The Red Cross War Memorial Children's Hospital in Cape Town says it has had 37 children testing positive for COVID-19, with 7 patients currently admitted to hospital. The hospital, the biggest specialised children's hospital on the continent, launched its triage and testing facility, which will add additional capacity to the hospital for children and caregivers. Hospital management says of 77 staff who had tested positive for COVID-19, 44 are back at work. Western Cape Premier Winde, who inspected the mobile facility, along with Health MEC Nomafrench Mbombo, says that the province is now in its second phase of rolling out triage centres, with 20 more due in rural areas of the province. Our reporter Vanessa Poonah has more.
Western Cape Premier Winde, as well as the MEC for Health, Dr. Nomafrench Mbombo, officially opened the triage and testing centre here at the Red Cross War Memorial Children's Hospital today. We've understand that this hospital itself has had 77 cases of positive staff members, 44 of whom have already recovered and returned to work. We also have been told that there are currently 7 patients in hospital. Those, of course, would be children that have tested positive for COVID-19. Speaking to us about the need for such triage and testing centres, of course, Premier Winde. Premier, we understand that the province now, of course, has an update in terms of the figures around COVID-19. Can you tell us where we are at this point in time?
Well, we're on 24,500 cases in total now, but 14,000 people have recovered. So we're now seeing the number of recovered now starting to grow over and above those that are infected. And then, of course, we hear it further. This is like stage 2 of health readiness. The original stage was building 18 of these at our hospitals. In the second phase in the city, we're putting up another 14 of these centres in and around the city, and then we will be going to stage 2 in the rural areas, which is another 20 of these testing and triage centres, which again is just separating in our hospitals, separating COVID-19 patients or suspected patients coming into our testing system versus just patients coming in, because we're seeing the pressure on the other side of our healthcare system, and just making sure that people understand that there is a separation. You can still come to the hospital and get your treatment done, and with children, really important at this hospital.
Premier, talking about testing and triage, there's also a new sort of risk-adjusted policy and strategy around testing here in the Western Cape. Those, for example, in the public sector, testing prioritised for healthcare workers, for people over 55. Can you explain why the province has decided on this new policy, and what factors attributed to that?
So, of course, I think everyone knows that our testing systems are under pressure in South Africa. We in this province have got 27,000 tests backlog, and 19,000 of them are longer than a week. So it really is putting pressure on the system. And when you have that kind of pressure on the system while we're waiting for new tests to come into the country, we need to make some management decisions. So the management decision now is the tests that we have got, let's make sure that they're the most effectively used. And so that's in our hospitals. So it is either patients being tested when they're coming in, or specifically our frontline staff. So our nurses need to be tested regularly, so we give peace of mind and stop too much viral load, etc. So that's real first priority in our hospitals. And then, of course, outside of our hospitals, who's vulnerable? And elderly, so over 55, we're saying that then you'd receive a test as a priority. Or if you've got a comorbidity, over 55 or lower than 55, because you're also at risk, people with comorbidities. And I think along with that, the message must be, if you're strong and healthy and you feel you might have contracted the virus, please just follow the rules of self-isolation and quarantine. Let's try and save the tests there if you yourself and you're not feeling really bad. We know that most people are going to be asymptomatic, and even if you are symptomatic, most people won't even need health care. So let's see if we can make sure that we don't waste tests while we're waiting for more to come into the country.
Is the province's risk-adjusted strategy or policy in keeping with the rest of the provinces and national?
So, we discussed this. We've had the pleasure of having the Minister with us for the last 2 days, having a look at our various readiness as well as our hotspot strategy that we've implemented. And I presume that it's going to be affected in other provinces as well. The Minister has also given us assurance that they're going to give at least this province some prioritisation of testing, as well as the other provinces like the Eastern Cape, Gauteng and KZN. So where those cases are higher, we will also in South Africa. So there's a prioritisation at a national level to those provinces, and I presume there will also be prioritisation within the systems, and I'm pretty sure it'll be similar to what we've
When can the province then, Premier, expect these testing kits and the reagents needed? But when, what's the time frame looking like?
Okay, so I'm not sure of that date, but I mean it was raised a few weeks ago with the President. It was raised again with the Minister now, before and now. And I know that they are busy hunting the world at the moment to get these kits in so that we can get our testing numbers back to where they should be. Because it's critical. We also need to be testing as our focus moves into the hotspots. And I mean, really great story where the Minister was yesterday to go out to Witzenberg and see where government and civil society get together. We can actually slow the spread, and it's working there. So we need to be able to show that we can get it to work here in our hotspots in the city of Cape Town.
Thank you very much, Premier. Premier Alan Winde speaking to us here outside the Red Cross War Memorial Children's Hospital. The first triage unit just opened today. Both the MEC for Health in the province as well as the Premier speaking regarding the need for such facilities, saying that 20 more are earmarked for rural parts of the Western Cape, as well as the second phase, which is expected to bring 20 more of these testing and triage centres to hospitals. Of course, this comes as the Western Cape has now recorded 601 deaths from COVID-19. Premier Alan Winde there saying that the province now in full swing with its risk-adjusted strategy in terms of testing in the context of a shortage globally of test kits, and also then the message once again remains to stay at home as far as possible, and also to maintain social distancing. Those who may have come into contact also to take the necessary measures to protect themselves and quarantine as the healthcare system, not just during the province, but we've seen globally as well, taking strain amid this pandemic.
All right, that's Vanessa Poonah in conversation with Western Cape Premier Alan Winde.